We do begin, though, with Robert F. Kennedy Jr. on Capitol Hill today, defending his leadership as health secretary and continuing his criticisms of the CDC. Secretary Kennedy testified before the Senate Finance Committee today, saying that changes to the CDC were necessary because of how it handled the pandemic. Kennedy faced a barrage of questions over his vaccine policies, as well as the recent firing of CDC Director Susan Maneras. In a Wall Street Journal op-ed this morning, Maneras says Kennedy isn't reforming the agency, but instead sabotaging it. She says she was told to pre-approve the recommendations of a vaccine panel with people who have expressed anti-vaccine rhetoric. But Kennedy pushed back against that claim.
I did not say that to her.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir. The scientists and doctors are supporting me all over the country. There is division on opinion.
And Dr. Tom Frieden joins us now. He was the director of the CDC during the Obama administration. He is currently president and CEO of the Resolve to Save Lives Health Organization. He is also the author of the upcoming book, The Formula for Better Health. And on top of all of that, he is one of 9 former CDC directors who wrote an op-ed in the New York Times this week saying RFK Jr. is endangering the health of Americans. Dr. Frieden, thank you very much for joining us. This op-ed certainly made a big splash when it was published. I should note that it came from these former CDC directors that served under multiple Republican and Democratic administrations. Why did you decide it was important to speak out?
What we're seeing is really unprecedented. This is an assault on public health. It's an assault on the people who dedicate their lives to protecting Americans from threats. And what we're seeing, particularly from Secretary Kennedy, is a string of untrue statements that are undermining our protections. He's denying, distracting, and destroying, denying simple truths, distracting with words from what his actions are actually doing, and destroying a lot of our protections.
And Dr. Frieden, I want to ask you also about Florida's move here to end vaccine requirements in school, an unprecedented move. What kind of effect do you think that would have on public health?
Well, vaccine requirements for schools keep all of our kids safe. If your kid has leukemia or other health problems and can't get certain vaccinations, your kid is going to be riskier if vaccine rates decrease. What we're seeing is a steady stream of misinformation, disinformation about vaccinations. Vaccines save lives. The vaccines in the childhood schedule are safe and effective. I've made sure my kids get them. I make sure my adult kids get them. This is something that is a great way to keep healthy, to stay healthy. But what we see from Secretary Kennedy is a long history of unscientific claims backed up by lawsuits that he, his family, his colleagues, his friends are pursuing against companies that result in big paydays for lawyers, but a lot of suffering for the families whose lawsuits don't go through, and a lot of unnecessary costs for all of us for unfounded lawsuits.
And Dr. Frieden, in this op-ed, you mention, along with these other former CDC directors, that state and local governments must fill funding gaps where they can. People have to step up in different ways. We also mentioned that California, Oregon, and Washington are forming this alliance to publish vaccine guidelines on their own. Do you get the sense that will just confuse Americans to hear different recommendations, or is this the right and only path?
It's a real problem. CDC exists for a reason. It can't really be replaced. But what we have now is a situation where you have an unprecedented firing of a CDC director. You have resignation of lifelong scientists who have spent decades working for the agency. And frankly, I never thought I would see the day where I can't trust information on the CDC website because I don't know how it got there and who put it there. Already we have a vaccine recommendation from Secretary Kennedy that's unscientific and denies healthy Americans, pregnant women, and kids vaccines that could help them stay healthy, specifically against COVID. And it may well get worse. So it's important that we have accurate sources of information, whether it's the American Academy of Pediatrics or the American College of Obstetrics and Gynecology or the American Academy of Family Practitioners. These are all important organizations. They're not conflicted. It's really striking. What we see from Secretary Kennedy is a claim that others are conflicted. For example, the former committee that looked at vaccines, none of those people had conflicts of interest. The people he put on that committee have severe conflicts of interest and very unscientific beliefs, and they're now potentially setting vaccine policy for our children.
Dr. Frieden, before we let you go, just one question. You said this very well may get worse. What is your biggest concern looking 5, 10, 15 years down the line here?
We can see more vaccine preventable disease. In a few years, if things keep going the way they're going, we will have large measles outbreaks again in the U.S. It won't probably happen tomorrow, but if we're undermining protections, that's a problem. In the medium term, I'm really worried about a lack of trust and confidence in the basic recommendations. In the name of rebuilding trust, he's undermining the basics for what we can do. And in the long term, basically shorter lives, higher healthcare costs, and more suffering.
Dr. Tom Frieden, thank you for joining us.